So many times we are experiencing something like pain or period problems, hormone problems, and we're told, well, that's just normal, or it's in your head, or you're maybe exaggerating how bad you may feel. Whereas in reality, so many of the times there are actual medical conditions that are causing them.
I was told about my biological clock in terms of getting married. There was a biological clock for me to get married. And now I feel like there's a biological clock for me to have babies. For the whole of my life, I was told how to prevent getting pregnant.
Yes.
Where is the school lesson in telling you, hey, listen, this is how you get pregnant?
A lot of people don't know about things like declining egg quality and number. So women are born with the number of eggs that they have their whole life, you know, when they are born. And as time goes by, the number goes down and the quality goes down.
What is the optimal age to get pregnant?
Physically, you know, the physical body probably ideally would be in your 20s.
20s, unfortunately. I've passed that.
I know, it's like,
And I think some of my listeners, if they want to have a baby, has probably passed that. So what the hell do we do? Is there any way in which you can increase your fertility the older you get?
I'm Dr. Karen Tang. Welcome to A Millennial Mind.
Today we're going to learn so much about periods, hormones, endometriosis, and really debunk all the myths that are around women's health. Before we get into this episode, I just want to ask you to do me a really big favor and press the like, follow, and subscribe button. It really helps me bring more of these conversations to you every single week. Let's get into the episode. Dr. Karen, welcome to Millennial Mind.
So excited to be here. Thank you for having me.
I was just going to say welcome to New York, but you live here, so I need to, and I was like, wait, hold on.
Sorry, I came from Philadelphia. It's still a journey. It's fine.
Yeah, welcome to New York. But I'm so excited for this podcast because I think there's so much we don't know about women's health. There's so much I don't know. And I think I really want to break that all down. So I want to start with your book. It's Not Hysteria. Why did you title it that?
I love this title. I think it captures so much of what we go through as women. So many times we are experiencing something like pain or period problems, hormone problems, and we're told, well, that's just normal, or it's in your head, or you're maybe exaggerating how bad you may feel. Whereas in reality, so many of the times there are actual medical conditions that are causing them. And I just wanted to kind of just right off the bat say, it's not hysteria. It's not in your mind. I actually go through in the beginning of the book the history of hysteria. So literally where, you know, from like Freud, where people said, oh, it's actually legitimately like in your head. It's because you're too anxious, because, you know, it's a psychological problem.
Right.
All the way back to like kind of ancient times where they literally thought that there was something wrong, like your uterus was broken and that was causing all, you know, your mood problems, like all your health problems was because your uterus was just like dysfunctional. So just the word hysteria kind of captures all of those things where, you know, throughout all of human history, women's bodies have been treated like they were just faulty, and that somehow that also meant that, you know, if something was going on with you, it was because either your body is broken or it's all in your mind.
Right.
So I just wanted to debunk all of that.
Let's start with the first thing that you just said around debunking all these common things. What's one of the biggest things that you discovered when writing your book that inspired you to say, okay, this is really a problem?
So even kind of before I wrote the book, my work as a gynecologist and then later doing social media, just hearing thousands and thousands of stories of women who had truly just suffered for years in many, many cases with things like, you know, really painful periods, you know, very heavy periods, fertility problems, sexual health problems, perimenopause. And in so many of those cases, like the story was very similar, that they had gone to see a doctor, they had tried for a long time to get help, didn't really get a whole lot of help, or sometimes the doctor just didn't listen or kind of dismissed their concerns. And then eventually people just sort of say, well, you know, I'm just going to kind of learn to deal with this. I guess I have to learn to deal with this. And that later on, they eventually do get care and they're like, oh my God, I wish I had known that there was something I could have done years ago. Right. And that story kept coming up so often. And it was always the same. I wish I had learned this 10 years ago, 15 years ago. I would have, you know, saved myself so much suffering. And it really broke my heart. It really felt terrible to know that in a lot of cases, these are things that we could treat, and that there was no need for the suffering. So both with the social media, and a lot of my social media posts are about like debunking common myths or raising awareness about some of these common issues. I wanted to kind of distill that into a book that people could have as a resource. My vision was to have something that people could have like in every house, and that from the time that you were young, you could share this and know about your body, and then have like an earlier awareness that if you're going through something, it could be PCOS, it could be endometriosis, and hopefully get the care that you need sooner. And I also wanted us to be able to have these discussions. Like, I think it's so important to break these taboos that a lot of people feel like nervous or embarrassed to talk about their periods, sexual health. Whereas all of us are going through the same things. Like, when people finally do talk about it, they realize like their friends, their relatives have all been through very, very similar things. And people just felt embarrassed to talk to each other. So I did want to just kind of open up this dialogue, just like we're doing right now.
Right. And I think periods are one of those things that we are kind of taught about in school.
Sometimes.
Yeah.
In America, maybe not.
I was just taught that you will get a period. Mm-hmm. That's what I was taught about. You will have a period and that's normal. Mm-hmm. I was not told what about it was normal. Mm-hmm. I was not told how long I should have it for. I still don't know. So let's really uncover that first. Because I think, all women go through periods and I don't know myself. So what is a normal period?
Yeah. And this is super important because people don't know. And a lot of the delay in getting care is sometimes people are like, I guess this is normal, but I'm not sure. So in general, we tell people more or less you should get a period once a month. It doesn't have to be perfect. A lot of people think if their period is not perfectly 28 days, and that's abnormal. Almost nobody has like rock solid like 28-day cycles, but somewhere in the range of once a month. We say anywhere from like 3 weeks to like 5-6 weeks. If it's regular, is normal. Right. You should bleed for a few days, and it could be anywhere from like 2 days to 7-8 days, as long as it's not so little that you're barely bleeding, or so much that you're bleeding for like more than 10 days, like 2 weeks at a time. You're not bleeding like in between periods. Right. And then the amount of bleeding is a big one. People aren't quite sure like how much bleeding is too much bleeding. So in general, we say if you are soaking through a pad or a tampon more than once an hour, or you're having to double up, if you have to wear a tampon plus a pad, or you're soaking through a pad onto your clothes, that is too much. And then now a lot of people use like menstrual cups, like those really, you shouldn't need to empty more than say like 2-3 times a day at most. Like, one menstrual cup is supposed to last you for most of the day. Right. So if you're bleeding more than that, that is a sign that you are bleeding too much. A lot of times it is very clear. As soon as a patient is telling me, they're like, oh my gosh, I'm like soaking through all my clothes. I can't leave my house. I have to double. I have to wear 2 pads at the same time. Like, that is way too much. So if you are bleeding that much, definitely see a gynecologist.
And what are some of the things that it could be if you're bleeding that much?
There'd be things like fibroids, very common. Those are benign or non-cancerous tumors of the uterus that are very, very common. They occur in up to 70% of white women, 80% of black women. I don't have statistics on Asian women or like Hispanic women. Sadly, we just don't have those statistics. But they're incredibly common. They don't always cause problems, but when they do, they can cause really severe hemorrhaging. And things like endometriosis or adenomyosis, which is very similar to endometriosis that affects your uterus, polyps, like those are all things that can cause abnormal bleeding.
What is endometriosis? Because I'm hearing a lot of people talking about it.
Yeah, which is a good thing. Endometriosis, like the endometriosis advocacy communities have been really active on social media, just talking about it and raising awareness, which I think is so important because it has traditionally been a condition that people did have to just suffer, silently for many years with. So it's a condition that affects at least 10% of women or people assigned female at birth, and it is where tissue that looks a lot like the tissue that's normally in the cavity of your uterus, like what you see when you have a period, the tissue or the blood that comes out as a period, where something that looks like that grows outside of your uterus, like between the uterus and the rectum, on the walls of your pelvis, in your ovaries. And it mostly causes really debilitating pain. So pain with periods, pain with sex, and it can inflame all of the other things in your abdomen, basically. So people have oftentimes really bad bowel symptoms. They can have really severe diarrhea, pain with bowel movements, like blood in the stool, and it can cause infertility. It's actually a very common cause of infertility. About half of cases of infertility in women can be associated with endometriosis as part of the cause. It's really, really, really an issue with fertility in some cases. And it's because it inflames everything near it. So that could be your bowel, your fallopian tubes, your ovaries, and it can cause issues with implantation of an embryo. So endometriosis, because the only way to diagnose it is actually surgically. Like, we can't tell you if you have it just based on an ultrasound, on a blood test. You actually have to do a laparoscopic surgery, put a camera in the body, and actually remove it, and then send it to a pathologist to say if you have it. So because that is the only way to diagnose it, it actually goes undiagnosed for many years. So in the UK, on average, 8 years between the time someone starts having symptoms to the time that they are diagnosed, which, can you imagine, like, debilitating pain? Sometimes people feel like they are just like in labor. It is so horrific. And they can't go to work, they can't go to school. So anyone out there, if you are having such bad pain that you just cannot function, it's getting worse and worse, it's not being relieved with over-the-counter medicine, that is a strong sign that you could have endometriosis. Especially if you have some of these other, like the bowel symptoms, like the fertility issue, like those are big clues that could be endo.
Why are so many of these issues going unnoticed?
I think because culturally it is so common to just think that women's suffering is normal. And I hate to say that, but it is true. I think that, in so many cases, we just say, oh, well, just everyone has bad periods. Everyone has bad cramps. That's just normal.
Yeah, deal with it.
Just deal with it. And that's both, the general public, but also like the medical community. Sometimes I think it's been so ingrained in people that, periods are terrible. Perimenopause or menopause is terrible. Like, just suffering is part of the deal, that we forget to kind of dig deeper and look for a medical cause. And for things like endometriosis, because it's not an easy diagnosis. So I kind of say for things like blood pressure, you can see if someone has blood pressure issues. You can see if their blood sugar is high or an EKG is abnormal. But you can't tell if someone has endometriosis unless you look with the surgery. And I think the fact that that's true, I think, has to do with misogyny too, because why didn't someone put a lot more funding into research to figure out an easier way to diagnose endo, because it affects women in general. And this is a problem worldwide, not just here in the US. There's just not enough funding for women's health stuff. So we just don't have all these medical breakthroughs and diagnostic tests and treatment options like you do for things that affect either just the general public or more men. There's so much research on things like diabetes or high blood pressure. I think I heard somewhere that the same number of people are affected by endometriosis as diabetes. Wow. But somehow there's just enormously more research and funding for diabetes than there is for endometriosis, even though they both cause such havoc with health.
I remember you telling me, and I don't think this is a problem just in the US, but it's the same in the UK, the amount of time you have with your doctor does not qualify them to diagnose you with something like endometriosis.
Yeah, it's terrible. And that's a system issue in both the US and the UK.
Right.
Especially for women's health, I will say in the US, we have an issue with insurance because the coverage for different types of healthcare is very different. And it all had to do kind of back when whoever was lobbying the government, like Medicare and Medicaid, for how much things were worth, women's health really was at the bottom of the barrel. So OBGYN offices in the US will sometimes see 40, 50 patients a day. Like, they just get so little reimbursement. They see a lot of patients, and there's just, not enough practices to kind of see all the patients. So you get sometimes in OBGYN offices like 10 minutes with your doctor. And actually I've heard in NHS clinics too.
Yes, it's similar.
Similar, yeah. It's like just 10, 15 minutes. And some of these conditions are so complex that there's no way to even kind of scratch the surface in 10 minutes.
Right.
And then so people are left really frustrated. They just really have not gotten even a little bit of 10 minutes not even long enough to tell all your symptoms, let alone talk about, what the diagnosis is, do tests, talk about your treatment options. Like, for me, like when I see patients, I'll spend like 45 minutes, an hour just kind of digging into this. And it is a big problem with the systems because that just contributes to people just not getting a diagnosis or the care that they need.
And if they want to go privately, how much would that roughly be?
So it depends on the place. And so, I have my own practice, and like some practices, it's a few $100s for the first appointment. Surgeries can be a few $1,000s, but there are
$1,000 for surgeries.
Yeah. And
wow.
I will say GYN surgeries are the lowest reimbursed of any surgery. So, even if we are, like charging like, what's it called? So in general, GYN surgeries cost maybe a few $1,000s.
Right.
Other surgical fields are much higher, sometimes an order of magnitude higher. So like orthopedic surgery, neurosurgery will be like, tens, $50,000. So GYN surgery is actually among the lowest cost of surgeries, but it can be a problem getting care. And I know this is the case in the UK as well, is that there are just not enough specialists.
No.
It's too hard to get to a specialist in many parts of the country, in both, UK and the US. People may have to travel really far to find someone who's a specialist in endometriosis, in hormone issues like PCOS,
yes.
fertility. So access is a big problem, and that is, only going to get worse. In the US, we've had a lot of issues politically with reproductive health, and
yes.
that has led to a lot of people leaving states where there are, say, like strict abortion bans.
Yes.
A lot of problems with gynecologic care. OBGYNs are leaving those areas because just, it's too dangerous to practice there. So that has really compounded the problem. Like people in some of these, I think Idaho, I heard, like there are many counties in Idaho where there are no OBGYNs at all. Like a lot of people have left that state. So it is a huge problem. There's so many systemic issues. And I know the UK with the NHS, you guys, I think, have recently had a lot of issues with different like kind of protests in the NHS. Is that right?
Yeah, well, look,
yeah.
but people are not paid fairly in the NHS,
Yes.
right? So people are no longer then going to continue doing their job with any... People are no longer going to continue wanting to go into the NHS. So we're seeing a massive shortage at the moment, and people are protesting to get paid more, which I think that they should.
Yeah.
I think the difference is in the UK, which, listening to this story, I'm very grateful for,
yes.
is we do have free healthcare.
Yeah.
It takes a long time, and sometimes it's very quick, and blah, 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 blah. Mm-hmm. But, if I had to still pay $500 for a 10-minute appointment, I think I would be shocked.
Yeah. Well, the cash pay is more for like giving people more time.
Right.
So
okay.
Exactly. It's the short visits are the ones that like, because insurance like only covers like so much,
right.
people are seeing a lot of patients to kind of, make their overhead. So
yes.
they will see a ton of patients in a day just to kind of keep the doors open.
Which is crazy because actually you're not doing it to serve the patient, you're doing it to cover your costs. And I think I was speaking to one of my friends the other day, and she was saying, if you are employed here by someone, then healthcare's included. Mm-hmm. If you work for yourself, then you have to pay for your own healthcare. Yeah. How much is that here if I wanted to pay for my own healthcare? It's
horrific. So yeah, fortunately, most of your viewers are in the UK, where you guys will appreciate your healthcare system more after this conversation. But in the US, sometimes people, if they're paying out of pocket for their own insurance plan, we were saying it could be like $5,000 to more than $10,000 a month for what's called the premium. And that's just to get the insurance. And then sometimes you have to actually pay out of pocket several $1,000s before the insurance will kick in and then cover additional costs, like if you were to have to go to the emergency room or have a surgery or, get like an MRI. It is outrageous. And like I said, the American healthcare system is very broken. Obviously the NHS has some of its own flaws, but the US system has really, really got to fix some things, especially when it comes to women's health. Women's health has really always gotten the short end of the stick, the least funding, the least research. So, and I think that goes back to what people value. Like,
100%.
If you think that women's health is not real healthcare, like it's not as worthy as diabetes, it's not as important as neurosurgery. Like women's health surgery is not as important as, getting your bones fixed or your, that sort of thing. It really trickles down to how the system values, women's healthcare.
I think it's the same in the UK. I mean, we're just not told anything.
Yeah.
And that's why I'm really and that's why I'm really trying to have this conversation to really tell people what is the baseline.
Yeah.
So I think one of the things that, you know, we're not really educated on is women's hormones.
Yes.
I'm just seeing all over the internet, hormones are bad. This is bad for you. Don't have soy because it's going to cause too many hormones. Don't have too much tofu every day. It's going to make you cry. Don't have too much estrogen. Women shouldn't have testosterone. Men have too much testosterone. I'm like so confused. What on earth are hormones and what the hell is normal?
There you go. I love it. So hormones are normal. It's a signaling process that is part of our normal functioning. So like estrogen, progesterone, testosterone. By the way, women have testosterone too. I think a lot of people don't realize that it's not that estrogen and progesterone are only women, testosterone is only men. Everyone has, you know, like estrogen and testosterone. It's just the amount that you have. So for women, when you know, go through your period all the way through menopause, you have cycles where your hormones will fluctuate.
Okay.
So estrogen will rise. When you ovulate, you will release a hormone called progesterone from your ovaries. And then, you know, the drop in progesterone actually causes your period to come. So they're kind of normal signaling processes where they go up and down. And we were talking before that a lot of people don't realize that some of the things that they feel in just the fluctuations of their health are from these hormones and may not realize that. So for instance, progesterone causes a lot of different symptoms. It can cause the moodiness before, you know, what we think of as PMS, premenstrual syndrome, where you feel really moody, you know, in the weeks leading up to and just kind of at the beginning of your period. It can cause bloating, breast tenderness, and then also a lot of bowel issues. A lot of people may not realize it can cause things like the bloating and constipation. When you have your period, there's a different hormone called prostaglandin, which causes the cramping of your uterus and also can cause you to have a little bit of loose stool or diarrhea. People call it like the period poops. So, you know, a lot of people, when they come to my office, they're like, well, I have constipation right before my period, and then I have diarrhea. Is that normal? And some variation of that is actually normal. That's actually kind of a, you know, slightly normal functioning. Now, when we were saying, how do you know what you're feeling is normal and a normal hormone thing versus is this something is bad going on? It all has to do with how it's affecting your quality of life. Right. So if you are so bloated and it's constantly that you're just feeling very uncomfortable, if you are having such bad constipation that it's causing you pain, or you're having really severe diarrhea, pain with bowel movements, like those are abnormal. But like a little bit of bloating, a little bit of looser stool, like that can be normal if you're noticing it, that's just like with your periods. So that's kind of just like normal functioning of hormones. I think you were right that there are a lot of these sort of like, I call it kind of like natural, like industries that have popped up, which kind of like they profit on making people scared about what they're going through. Like, you know, I have to like detox my hormones. I have to like, you know, if I'm having a little bit of bloating, that's really bad. It means I have to go on this special diet or take this special supplement. And I tell people, like, if it's not affecting your quality of life, you don't have to do anything different. You don't need to buy a special like detox or anything. And I'll say that most of those things don't have research to back them up. They can make a lot of claims about, oh, this will fix your life, this will, you know, make your health better, you'll sleep better, you'll have more energy, but they're not held to the same kind of regulatory standards of proving that scientifically, like, yes, this will definitely like have this effect. So, you know, I would tell your listeners, just be really careful. You'll hear a lot of marketing towards normal things that and common things. They make a lot of money because a lot of people have bowel issues. A lot of people have mood issues or issues with weight. I would just say that almost always like that kind of, you know, product doesn't have something substantial to say that it really works, and they're often really expensive. Right. So yeah, so don't kind of buy too much into like the marketing ploy. Kind of another aspect of hormones that you mentioned is what are the potential effects of things like hormones we prescribe. So birth control, hormone replacement therapy. They all have their place. I'll just say right now, like nothing is for everyone. So sometimes people, especially in the US, there's been a lot of rhetoric against hormonal birth control, especially from kind of like extreme, like kind of conservative, you know, folks. Like for some reason, like they've kind of started being like, no one should take, like Elon Musk, I don't know if you heard this quote, like Elon Musk was like, no one should take hormonal birth control. It makes you fat, it makes you suicidal. And it was horrible. Like he quoted some crazy, like he made up some statistic where it's like it increases like suicide rates like threefold. I mean, it was insane. So I will say nothing is universal for every single person. So if you hear someone saying something that's claiming that X is always horrible for everyone,
it's not true,
and no one should ever do this, like it's rarely true. Everything in medicine is a little bit more nuanced. Like we have to talk about, you know, like what is the research, what's the data, and things have more risk for some people than others. Like, you know, some people have like, you know, existing, like if they already have depression and anxiety, they do have a higher chance of having depression or anxiety, say maybe with hormonal birth control.
Right.
And, you know, somebody who has a strong family history of breast cancer, you know, they may be, you know, a little bit more cautious about hormonal medications because if they're worried about breast cancer risk. But not everyone's the same. So everyone has a little bit of a different risk, you know, like their different preferences. And we were saying that, especially in the US with all of the attacks on abortion,
yes,
you know, telling people that every single person should come off of birth control right now is obviously super dangerous because, you know, what also causes mood symptoms and, you know, all these other things, blood clots, is pregnancy. So if someone doesn't want to be pregnant right now, they're happy with their birth control, they're not having problems with side effects, I would say, like, that's great. That's who the birth control is for, is that person who wants to not be pregnant and is doing well with it. It's not to say that every single person should all be on birth control, but we should have that choice and we should be able to counsel people and give more accurate information. It shouldn't be like this fear mongering or like no one should ever do this. No one should ever be on hormone replacement therapy. You know, that's obviously not true.
This policing on women's bodies is really annoying me.
Oh, it's horrible.
It makes me so angry.
You can't understand what it's like to live here.
Why are there
as a
so many
gynecologist,
comments on what I should be taking, what I shouldn't be doing, whether I should choose to have a baby, whether I should choose not to have a baby, whether it's, you know, ethical for me to do it or not?
Yeah.
It's infuriating.
Oh, no, you should. I mean, I when I make videos, I have to like restrain myself all the time. I have to like, I can't just be like let out a string of expletives, but if we feel like that, because you're right, like there's so much of policing of women's bodies, every choice you make, we kind of say there's no, like, you can't do it right. Like, you know, you either have to have, you know, like a lot of children, if you choose not to have children, if you have children too early, too late, you know, how many children you have, there's judgment on almost all of it. And, and, you know, I think most of us would say like it should be your personal choice. Like right now, the Supreme Court is fighting over like, should we doctors be allowed to give emergency care to someone who is pregnant and potentially give them a life-saving abortion? Like if they're hemorrhaging or they're septic, and literally they're deciding right now, like, will doctors still be prosecuted if abortion is illegal? And it boggles my mind. I truly, every day, I'm like, I don't understand how we got to this place in America.
It doesn't make sense to me.
It's terrible. So yeah, you know, those of you in the UK, like, appreciate the rights that you have.
I mean, I think that those are basic rights. And I think it makes me so sad to think that the people who live here, who perhaps have gone through something really traumatic, or you know what, just decide they don't want to have a flipping baby.
Yeah. Yeah.
And they got pregnant by accident.
Yeah. And birth control failed, or like, God forbid, they were assaulted. I mean, yeah, there's so many things out of your control.
Forced, you know, but I think this is a topic for another day where, you know, I'm allowed to just profusely swear for about an hour. This is going to be like a wellness podcast, uplifting, so let's not make it depressing, but also thank God I live in the UK. I want to also talk around the hormone differences between men and women in the sense that I think a lot of women are shamed for being on their period. Yeah. You know, it's changing for sure, but I'm challenging myself often. Like yesterday, I started my period. In my vlog, I said, I've started my period, I was having a bad period pain, and I wasn't in a bad mood. But let's say I was in a bad mood. And I said, you know what, I'm just having a really bad day because I'm on my period. People are like, oh, for God's sake. They're not like, oh, that makes scientific sense that you have lower levels of progesterone. Is that correct?
Or higher.
So close. You have higher levels of progesterone. So Shivani, that makes total sense. You're in a bad mood.
Yeah.
What can I do for you?
Yeah.
You know, that would make me, everyone, if I said that to someone, people are listening to this podcast that are perhaps, you know, thinking what we're saying is barbaric, are going to be like, how entitled of you for you to think that we should know that, right? But we don't know that.
Yeah.
And so when someone says, I'm on my period, I'm in a bad mood, we're just like, okay, we'll just leave you alone and like, you're not normal and that's weird. Why is it that women experience this? It's scientifically proven, right? Yeah. It happens a few days before sometimes, or sometimes like a couple of weeks before, right?
Yeah. Oh, and actually, I want to say you were actually correct. I was thinking of PMS. So PMS is when it's high progesterone before your period, but then when you have your period, it's dropped, and it's actually just like the fluctuation. Like your hormones have just gone from like high to low, and so you do get like a swing like of your moods, and so and it is normal, and like you said, it is there's so much judgment associated with that. Like people will, it's almost like it's like a slur to be like, she's PMSing, like she's so PMSy, like it's like that she's just being a bitch, like, you know, and it shouldn't be. It's like a normal, we call it like a physiologic experience that people get mood swings with before or during their periods or when they're pregnant. You know, these are normal things. And like you said, there should be just more understanding of that. I think, again, it's just kind of historically and culturally, like people have assigned these thoughts to when a woman is having like hormonal experiences, or same thing with perimenopause, menopause. There's sort of like this revolution going on now, as like, you know, I'm Gen X, as you know, my generation's kind of getting into that age range where we're like, yeah, it's okay to be going through some stuff when you're going through perimenopause because your hormones are all over the place. They are totally swinging wildly, and you're going to feel like, you know, bad sometimes. You're going to feel really moody, or have like sleep issues, like that sort of thing. So during all of these normal parts of life where, like you said, people kind of just like judge women for it. They're like, you know, oh God, what's wrong with her? She's so moody. You know, we should have a little bit more sympathy and understanding.
I think what you said in terms of the research is really clear that it's actually really lacking in our society, because I saw a reel on Instagram the other day, and it was this dad, and he said, I don't want to we have 4 daughters and I needed a son because I couldn't deal with all of them PMSing at the same time.
Oh my God.
The comment section were like, what an awful father, the most misogynistic man. And I was like, oh my God, I didn't even like think of it like that badly, because it's so normal for people to insult you for being on your period. But also, I think, you know, there's no understanding around the fact that perhaps during that time you're not going to be performing at your best. So for example, when you're at work, you know, there's no understanding that if you're on your period, you can just say something like, hey, just to let you know, I'm struggling a little bit right now, or, you know, I'm feeling extra tired, or, you know, I'm getting a lot of cramps. You know, we were speaking about this before. I don't really suffer that badly from period cramps. Yesterday, when I started my period, I got them really badly. But luckily, I took 2 paracetamols that my mom always recommends. Her saying in life is take 2 paracetamols and say a prayer. But I did, and I was fine. But it really made me think about the times where so many people who have endometriosis have told me, you know, I cannot get out of bed. I cannot go to work. And there are some industries in which those people are not paid for it, you know? So a lot of the time women are falling behind, or they are, you know, losing out on work because they're not able to work because of being a woman. And it's so crazy. And I think that there's a complete lack of understanding around that, and a complete lack of research.
I've heard a lot of people now kind of giving talks to industry and different like employers, like large organizations, trying to help raise awareness about these things. You know, menstrual pain, like PMS, and also things like fertility, perimenopause, like all these phases of life where people, you know, their productivity may be affected, their ability to come to work, that there should be a little bit more understanding that it's not just like a rare occasional person that is affected. It's a lot of women.
100%.
And that, you know, in general, it is sort of, so for instance, my husband just injured his hip. And he had to do physical therapy. So he had to take some time off and, you know, go to his physical therapy appointment. Every employer would be fine with that.
100%.
No problem. Of course, you hurt your hip, you got to go to physical therapy. But if you have endometriosis and you're debilitating pain, you know, like you need to go to a doctor's appointment to see your gynecologist. Like I think a lot of people will be like, you can see the gynecologist during the workday. You know, there's such more judgment about like, is that really necessary? Like, do you really need time off to go take care of that medically? Or is it just that you just can't tough it out? So I think that, you know, that really illustrated for me. I was like, why is it so easy for my husband to say, I just got to take time off to go to the physical therapist? Like,
exactly. And you know, women are so tough. I just want to say, you know, every time I'm having a period, I'm like, how will I survive childbirth? You know, seriously, how am I going to, yesterday I was like, oh my God, imagine when a baby, but if you think about it, it's pretty flipping nuts that a baby is birthed from your vagina.
Yeah.
It's wild to me. I'm like, we are superhuman.
It's crazy.
And it's like men are the ones that are like, there's this experiment that you see.
Have you seen where they put the cramp simulator on the men and they're like,
I think there should be a non-negotiable for every single man every month. I think men should all have to do it. And I'm just joking before you all tell me you hate me. But no. fertility is a topic that I think I was so naive about. Mm-hmm. You know, I'm 30 now. Mm-hmm. And for so long, I was told about my biological clock in terms of getting married. There was a biological clock for me to get married. And now I feel like there's a biological clock for me to have babies. But I did not know about egg freezing, for example.
I was just about to talk about that. Yeah.
Because when I started this podcast and I was talking about different controversial and taboo topics, egg freezing was one of the topics that came out. For the whole of my life, I was told how to prevent getting pregnant.
Yes.
In school, do not have sex without using any contraception. Yes. When you're older, be very careful. It's very easy. You will never know. You know, you hear these stories of people like, I only realized that I was pregnant when I was 6 months in because I didn't show. And you're like, oh my God, you must use all forms of contraception and you must be educated around all forms of contraception. Where is the school lesson in telling you, hey, listen, this is how you get pregnant?
Oh, no. Yeah. It's funny, when I was doing another podcast and we realized that all the sexual education and all of like just sexual health is geared towards preventing something bad.
Right.
It's not about how to achieve something good. It's about preventing STDs. It's about preventing unwanted pregnancies. But yeah, they don't talk about like how do you make sure that if you want to have kids someday that you preserve your fertility or like, you know, how to have like a satisfying sexual relationship. It's all about like danger, avoid it. And not like, you know, here's a goal you might have and here's how you can achieve it. So a lot of people don't know about things like declining egg quality and number. So women are born with the number of eggs that they have their whole life, you know, when they are born. And as time goes by, the number goes down and the quality goes down. And that's why it's harder to get pregnant over time. And also things like miscarriage risk and Down syndrome risk do go up as you get older.
Right.
It doesn't happen like all of a sudden, like people think of it as like you're 35 and just like goes off the cliff. It's not like that.
Okay.
But just over time, it will gradually kind of, you know, like the chances go down. And that's where things like egg freezing are really important. If someone knows that they want to put off pregnancy until a certain time because of, you know, like their career goals or education, or they don't have a partner, egg freezing is actually really amazing. It helps to kind of just like stop the clock.
Right.
And if you have access to it, which I think actually, is it covered in the NHS? I actually
don't
know.
think it is.
Oh,
I'm not sure.
Yeah.
I'm not sure. I don't think it is.
It is expensive, but a lot of employers now in the US,
yes,
like
I do
big
know that.
employers will cover it as a benefit, which is amazing. It's really great. And I think it really helps to keep women in the workforce.
Yes.
If they know that, well, you know, I can do this for myself now and preserve my ability to, you know, have children when I'm ready for it. So I think that is important. You know, if you have listeners who are thinking, well, you know I want to have kids someday, but it's going to be like 5-10 years and I just don't want to, you know, lose my chance, or I want to optimize my chances. Like it's a great option. Make an appointment with a fertility specialist. They're called reproductive endocrinologists and fertility specialists. So something to look into. And I would say, the associated, you know, sexual health. Like we don't ever get taught, like, you know, how do you communicate with your partner about your sexual needs, or like, you know, what if you have difficulty having an orgasm, you know, all these things, right? Like we are never taught that.
Yeah.
And people are just sort of like left to, you know, either struggle it out or, you know, figure it out, you know, among themselves. But there is no kind of formal process for like learning about all these good things.
Yes, I agree.
Yeah.
But I want to talk about fertility in a bit more detail.
Yeah, of course.
Okay. Mm-hmm. What is the optimal age to get pregnant?
So it's different depending on whether you're talking about like the physical body pregnancy and everything else associated with, you know, being pregnant and having a child and like being in the right kind of, you know, like do you have like the time, the resources, the ability. So I always tell people there's not like an ideal time for every single person. So, you know, if you're talking about like kind of like physically, you know, the physical body probably ideally would be in your 20s. That's when things like the risk of the miscarriages is lower, like Down syndrome risk is lower, and things like preeclampsia and stuff like that will go up higher, and gestational diabetes, like things like that, like may go higher as you get older.
Right.
There is actually being too young is also associated with more risks. So obviously your body's like not mature enough, and then some of these pregnancy concerns are higher in like teenagers or people really young. So kind of like 20s is sort of the ideal time biologically, perhaps, but a lot of people in their 20s aren't ready for just other social reasons. Like they, are in school, or they're just getting started with their job.
Right.
They may not have met their partner yet if they want to, have a child with a partner. So I tell people, the right time is always up to you as an individual. And don't feel pressured to go again, according to someone else's clock. I think that could be, parents or like peers or like society. People feel a lot of pressure, like you're too old, like you're, your relatives may ask you every time they see you, like, why aren't you having kids yet? So, if it's not right for you, it's not right for you. And just, know and have confidence in that.
So 20s, unfortunately, I've passed that.
I know, it's like,
and I think some of my listeners, if they want to have a baby, has probably passed that. So what the hell do we do? Is there any way in which you can increase your fertility the older you get? Are there any of things that you can do, bar lifestyle choices of like eating healthy and not smoking and not partying and not drinking?
Yeah. And I always tell people, again, it's not that, as soon as you get into your 30s, it's all over. Like obviously many, many people like have wonderfully like healthy pregnancies and no issues like into their 40s. Right. It's just that we tell people because, it's important to know just so you can make decisions as well. Like if someone is wanting to be pregnant and perhaps knowing that information, they would say, what, actually, we're ready now. Like we can try now, and not put it off years and years just in case. Like I said, if it's not right for you, it's not right for you. But sometimes just knowing that bit of information actually helps make that decision. So in general, we tell people there's nothing that you can do to like kind of reverse things like the loss of eggs. Once the eggs are gone, they're gone. But you can just make sure that you're healthy for pregnancy in other ways. And that is, just like, taking care of your health, like making sure that you're eating right. Avoiding the smoking is important. Avoiding like kind of like, binge drinking, and everything kind of in moderation except smoking. And just making sure as healthy as possible. And that just kind of like improves your likelihood of having a healthy pregnancy when you're ready to be pregnant. There are, I think, some people who kind of, again, like prey on people's concerns about their fertility and will like be like, you must take this like vitamin concoction and that sort of thing. We do tell people, make sure you do take a prenatal vitamin if you are trying to get pregnant with folic acid. That prevents birth defects like spina bifida. Prenatal vitamins also have like things like iron that are important for health. But beyond that, there's not like a specific like concoction of vitamins you must take. You don't need to like do a certain thing to make sure that you're okay. Stay healthy, like live your life in moderation. And that's sort of, what we suggest. So
for somebody at home listening right now, they are worried that perhaps they can't have a baby or they can't conceive. There's obviously routes like IVF and adoption and surrogacy and so many other routes. And actually in the UK, you can get tested pretty quickly, right? To see what your egg count is. What's a normal egg count?
So we don't actually like count the like total number of eggs because it's like, like hundreds of thousands. There are tests called like antral follicle count, which is where they can, count the number of eggs you can see as follicles. And I'm not a fertility specialist, so I don't know like the nuances of that test, but there are things like that test. There's something called anti-Mullerian hormone, which is, we say, not a test to tell you if you're fertile or not. A lot of people are marketing it like that. So you may see that like a direct-to-consumer marketing about like, you got to check this. Do you know how fertile you are? It's not used that way. It's used in fertility testing for someone who has experienced infertility, like they've been trying to get pregnant for like 6 to 12 months and they haven't succeeded. It helps predict how well they'll do with IVF. So it's helpful. We get that test for those patients so we can get a general sense of, like their response and like the reserve, but it's not something that's meant to just like test the average run of the mill person and tell you you're infertile, you're not. That's, it doesn't work like that. So again, if your listeners have heard, you got to get this test, like that'll tell you if you're fertile or not. It doesn't work that way. So in general, We do check hormones if someone has been trying for a certain amount of time and hasn't succeeded, or if they've had things like miscarriages, like they've had multiple miscarriages, we get testing as well. But in general, we get the testing only really when someone has had difficulty, because also important to know about hormones is they fluctuate all the time. So they fluctuate from cycle to cycle, day to day. So just getting like one blood test also doesn't necessarily tell you about how your system's working, how many eggs there are. And there's unfortunately no test for how the quality is. So we actually can't tell the quality of your eggs.
No way.
Unlike, so again, this is unfair. Like, for men, you can get a semen analysis. You can see exactly what the sperm look like, how they're moving, how many there are. But there's no test of egg quality unless you do like an egg retrieval and then you see what happens with them. We can't just do an ultrasound and tell you your eggs are good.
What?
I know. Again, yeah. Like, so for men, they can do a semen analysis real quick and be like, this is exactly how their sperm are performing. But
hold on. Yeah. So if I want to go and see how likely it is I'm going to get pregnant, I can't see that.
There's nothing that will tell you like that your eggs are good quality. Or so we can tell you about like basic things like your hormones. Like, for instance, if someone is going through like an early menopause, like premature ovarian failure, we can see that in hormone levels. You can check things like antral follicle count to get a general sense of like what we call the egg reserve, which is like the number of eggs, like a guesstimate about number of eggs. But you can have a certain number of eggs and the quality is not very good. So people can have things like, like recurrent miscarriages or problems with implantation and stuff like that because of the quality of the eggs. So unfortunately, there's no test for that.
Fascinating.
So again, we need more research. Like, shouldn't there be a test that tells us?
Absolutely.
Personally, we don't. And so it is tough because it is sort of left to be like, well, let's just see what happens when you try.
It's actually so fascinating because I was talking to someone the other day and they were just saying, well, women can just go and get checked every like 3 months to see how fertile they are. And what you could do is just think about the percentage ratio. You're saying that you should go and get checked from the doctor every 3 months. So a woman should go every 3 months to check how fertile she is. And then you're going to predict it because a doctor cannot predict in a year's time what your egg level count is going to be, can they?
No. Like, I mean, and first of all, like nobody would do that just because it would be such a pain to like keep going to the doctor getting hormones drawn. Like nobody will do that.
It's painful, right?
Yeah, like your blood drawn. So we wouldn't do that to someone. But again, like, we can't exactly tell. Like, and we always say like someone could have things look not great on paper, like their hormone levels may be like kind of heading into perimenopause range, and they can get pregnant the first time that they try.
Oh, wow.
Or someone could have rock solid, perfect everything and have difficulty getting pregnant. So like numbers don't necessarily even tell you the reality of what your fertility is like. So that's why we say we kind of just see how you do. And if it seems like you're having difficulty or it's not happening, then we do more testing, like, then you see the fertility specialist. They do more specialized tests like the antral follicle count. So yeah, we do a little bit of like, see how you do. And then if troubles, then, do more evaluation.
Do you know what's so interesting? Yeah. We know our body's the best. And yet there's always room for reasonable doubt. The machines that you use in your surgery, not you specifically, but, medics use, I did not know that they were not 100% accurate.
Oh, yeah.
I did not know that.
Yeah.
It was only recently where I found out that they're like 92%, 95%, 97%. I've always thought that they are 100% accurate.
Oh, like labs and things like that.
Crazy.
Yeah. There's always like some range of like, like.
Which is normal.
Yeah.
It shouldn't. Yeah. It's just that we are sold this dream. We are sold this idea that everything that is scientific is 100% true.
No. Yeah.
But then actually, when you are looking at your own body and you're like, this feels weird. Yeah. This feels wrong. You're so hysterical. Yeah. Like you're so paranoid. Yeah. And, you just are making things up.
Yeah.
Fascinating.
I actually say this in my book that for so many things for women's health, there's not like an EKG. Like, like you can look at your heart rhythm or, again, like your blood pressure measurement. But for GYN stuff, there's not really like a perfect test that tells you exactly what's going on. So, again, endometriosis or things like, PMDD, premenstrual dysphoric disorder, where people have really debilitating mood symptoms, like with their periods, like right before their period. they could have perfectly normal hormone levels. Like if you test their hormones, they're normal, but it's the impact of it on your health. And you're just like, I feel horrible. Like people feel just awful. But objectively, it's not like there's like a number or a test that said yes. You know, like there's no objective data that can kind of point to it. And so again, doctors love objective things. We're like, we love like a number or like a test that said, yes, you had this positive test. But for so much of women's health, there's nothing like that. And that's where people, you know, in the absence of something that is like clear cut, like a number or a, you know, figure on an EKG, we say, well, that must be normal then.
Yes.
And, you know, despite what you feel, and so much of all these problems is subjective. So people like feel terrible. They have horrible pain. You know, pain is completely subjective. There's no like, you know, like test, are you having pain on an EKG? Like, you know, so the problem with that is that, you know, it's all then based on what the person's saying. It's like, I'm in a lot of pain. I'm really suffering. But all your numbers look good, all your ultrasounds look good, it must be normal. So that's where the hysteria part gets called in, is that, you know, we start to say, well, maybe it's in your head because I don't see anything on my paper or my test result.
One of the best things that I watched when it comes to explaining women's hysteria and kind of really comforts me is the Nike ad where Serena Williams is narrating it, so I'm going to say it.
Oh, yeah.
If we show emotion, we're called dramatic. If we want to play against men, we're nuts. And if we dream of equal opportunity, we're delusional. When we stand for something, we're unhinged. And when we're too good, there's something wrong with us. If we get angry, we're hysterical, irrational, or just plain crazy. But a woman running a marathon was crazy. A woman boxing was crazy. A woman dunking, crazy. Coaching an NBA team, crazy. A woman competing in hijab, changing her sport, landing a frontside double cork, or winning 23 Grand Slams, having a baby, and coming back for more. Crazy, crazy, crazy. So if they want to call you crazy, fine. Show them what crazy can do.
Oh my
and
God,
it's
I love that.
one of my favorite ads to watch because it just shows us that, you know, we can be labeled all these different things. And nothing will stop us. That's what I really love about women coming together, is that we're so much stronger.
Yeah, absolutely.
Right? And, you know, all of these different things we've spoken about today, they haven't been researched, but we're still here having a conversation about them because, you know, together we can learn about them. Together we can find a solution. Together we can really debunk these myths that we're hysterical, we're so crazy, we're overdramatic. Because, and I was also researching this, there was a scholar who was at Princeton University or Columbia, I can't remember, and was a scientist, and he was saying that hysteria came from the fact that it was so unladylike for women to show their opinion that we just call them hysterical. Like, it was so unladylike for women to just say something. It was like, oh my God,
like, it's abnormal.
It's abnormal for you to speak.
Yeah.
What was one of the biggest myths that you found in the research of doing your book that you want to kind of completely bust?
Oh my God. I mean, just the overarching theme of that, you know, if you're going through something, you're supposed to be just suffering. And just kind of coming back to the fact that so many times when we dig a little bit deeper under the surface, we find a medical condition. We have something that we can treat, that we can give some help for. And it's not that you have to just kind of like stifle it down and just like deal with it and suffer with it silently. I mean, I love the idea of like kind of transforming the idea of hysteria, reclaiming it, and just being like, no, like, you know, if you're going to call us crazy, like, yeah, let's really like use our voices and say, actually, you know, if you think we're being loud now, like we are really being loud and we're going to kind of take back all of this stuff and we're going to, you know, debunk all these things and take back our power. So I love that. That's fabulous. I love that. And then one thing I was really shocked by just in the researching of it is just like how bad it is in terms of, you know, like research funding. One of the most shocking facts I learned about was that the NIH, which is like the big medical funder in the entire world, in 2022, like spent like $10 million more on smallpox research than on endometriosis research, and twice as much on smallpox as for fibroids, which again affects up to like 80% of women. The smallpox was like eradicated. like in the 1940s, but because I'm sure, and my guess is that they do it because of like biological warfare or, you know, it's about protecting like national security. Like that is so much more important than women's health. Like the actual like lived suffering experience of women versus the theoretical risk of like someone using smallpox to attack our country. It's perceived as being more important. It's worthy of more money. It's worthy of more attention. And it's obviously not. Like, so yeah, let's just kind of say like, you know, we as women, we deserve like attention, funding, like to be taken seriously, to not have to suffer through this, to, you know, feel like we have a voice and we should be able to change these crazy things. Yeah. So yeah, it's the system that's crazy. It's not the people. Let's just say that. Yeah.
I completely agree. And I think we put so much focus on fixing the people.
Oh yeah.
And so much less focus on really understanding the complications that we are in the system.
I love that. Yeah.
Thank you so much for sharing so much knowledge with me today.
This was amazing. I really enjoyed myself. I think this was a wonderful conversation. So thank you so much for having me.
My pleasure. Thank you.